Hi, everyone. Thanks for coming today and allowing me to present for you all. I'm going to be talking to you about a multi-institutional expansion of a longitudinal radiation oncology curriculum for medical assistants and allied health professionals. We call it OnC. Next slide. I have no disclosures to report for this. Next slide.
You should be able to control yourself.
Oh, can I?
Yep, there you
Oh, great. At UCSF, we launched a resident-run interprofessional program for medical assistants back in 2017. The interprofessional course basically consisted of a series of lectures that were given by residents to our medical assistants to help them better understand how radiation oncology worked. In 2022, we completed a 4-year single institution pilot, and we accomplished a few things, including diversifying the attendance to some of our allied health professionals. And we also had more interprofessional instructors. So rather than just residents giving the course, there are also registered nurse and nurse practitioners that were involved as well. We plan to move beyond that this year in expanding our program from just UCSF to other institutions. We want to better integrate the allied health professionals, which we basically mean by nurses or nurse practitioners, also dosimetrists and others beyond just the medical assistants into the actual course. And we want to do a better job of tracking the growth of our participants in real time as we move forward. So we recruited 3 additional partner sites. In this case, all of them are on the West Coast. And we did a needs assessment across the sites to better understand the needs of the staff that were there. It was open to all of the sort of non-medical staff that were working in those institutions. And then we adapted existing course materials based on the information we got. And we included pre-post session multiple choice knowledge assessments to complete evaluations to each of the lectures. So the things that we included for the beginning of this included an introduction to radiation oncology. We had information on vital signs, triage medications. And then after that, we had disease site-based lectures as well. The goals of each of those sites, we reviewed epidemiology, clinical presentation, some diagnostic workup, really looking along clinical guidelines and helping them navigate where they could actually find those guidelines. And then we used the management sections of each of the presentations to scaffold the role of radiation, surgery, and medical oncology in the treatment of cancer patients. And importantly, we talked about acute and late toxicities that one might expect while someone's being treated with any sort of cancer care for them as well. So I'm going to talk a little bit about things that we found. When we did our needs assessment, we got a much broader set of people. So before we had mainly medical assistants that were participating. You can see that the distribution changed significantly. We had still mostly MAs, but we had an increase in registered nurse, LVNs, and advanced practice providers. And then the others included administrators that actually wanted to join, and then also dosimetrists as well that were at different institutions. We saw kind of a split between what our participants felt they were comfortable in. So many people felt comfortable in kind of the more general things in terms of how to take vital signs and what those might actually mean. And then they understood a little bit about cancer symptoms. As they got more into things like the role of radiation toxicity, and radiation delivery, they were consistently saying that they did not feel particularly comfortable with this information. And they felt that they would greatly benefit from disease site-specific instruction. We allowed them to also enter free text responses in terms of things that they felt that they would benefit most from. And over 2/3 of two-thirds of respondents specifically noted that they would benefit from more instruction on managing side effects, particularly when it came to skin reactions. So we took this and we adopted this into the course content that we were doing before. And so I want to show you a little bit of the data that we got back. So with each of the courses, we did a pre and post session survey that allowed our users to rate their confidence with the material or their perceived confidence. And we also did included in that knowledge assessment where we had multiple choice tests that basically allowed them to select the correct answer for at least 5 or 6 different questions with regard to the topic that was being covered. The questions themselves for the knowledge assessment were included in the lecture, but they were not deliberately highlighted in any of those. And sometimes a question would carry over from one lecture to another. So in this, we saw that in each of the sessions, this is looking at 4 of the sessions that we ran. We're looking at the pre-post on the left in terms of comfort, and we could see consistently there was an increase in the self-reported comfort in the topics that we were talking about. I think particularly we started seeing a big difference when we got to the disease site based ones. So for example, prostate cancer and then spinal metastases. And then we went to knowledge assessment. We didn't see much of a difference in terms of general radiation oncology, but we did start seeing that difference emerge when it came to medications, vitals, prostate cancer, and then spinal metastases. Interestingly, we also asked our participants to rate the clarity of the presentations that they were having and the sessions that they were participating in. And 100% of them felt they were clear and easy to understand. And despite the fact that this was a mixed audience that included people of different training levels, 85% agreed that the content was the appropriate amount. There was another kind of 10% that felt that perhaps it was sometimes too much, and then maybe 5% who said that it was too little. But it was great to see that the vast majority of people who were there, despite the fact that it was a mixed audience, felt that it was appropriate and were benefiting from the content. So some of the feedback that we got from our participants is that they were experiencing some challenges with attending sessions. We do purposely try to make sure this is synchronous, at least at this stage, where everyone comes and they can participate in each of the sessions. Participants did desire a platform for more asynchronous review of the content, just so that they could basically adapt around their schedules. It was most difficult for them to actually, I think the biggest thing that we found is that sometimes participants would have difficulty because it would conflict with something in clinic or something would come up and they would have to maybe not come or step out in the middle and miss something. And then they wanted sessions that were increasingly interactive, which we had some aspect of within the sessions, but was limited based on our current web-based platform. So we saw that our radiation oncology specific training is desired by MAs, RNs, APPs, and other healthcare staff across multiple institutions. We were successfully able to expand it to different institutions and get consistent participation across different professions. Participants report a higher comfort with topics after each course attendance. They tend to score better on the post-knowledge assessments, particularly in the disease site-based ones. We want to move forward by increasing the interactive engagement with participating sites. We're going to pilot more web-based modules that promote more asynchronous engagement with the content and continue to revise our instruments, our knowledge instruments. One of the things that we talked about before is that some of the questions we're carrying over, we don't quite have enough sessions to analyze this yet, but we're trying to increase things like spaced repetition in our assessments just to see whether or not our participants are having long-term retention of the information that we're doing as well. Since we hope that this knowledge is something that will stick with them beyond just the session. And with that, I'll take any questions. And thank you to all of these people who've definitely helped, particularly Sumi Sinha, who's helped carry this before me, and Melody, who sort of found the program, a variety of nurse practitioners and other people as well, and then our partner sites who have been very helpful in maintaining this.